Hi everyone, Dr. Amy from Pain Free and Fit. Today, a great exercise for those of you with degenerative disc disease, herniated discs, and bulging discs. The weighted anterior pelvic tilt with dip belt. Hope you enjoy. So those of you with degenerative disc disease, herniated discs, and bulging discs, looking to increase the strength and endurance of your extensor muscles, the multifidus, the erector spinae, the latissimus, the glutes, the hamstrings, need to incorporate exercises in the standing position that usually help to increase the lordosis or curve of the back. That's because most disc sufferers, again, not all, but most disc injury sufferers, have a tendency to have their pain aggravated with flexion. As they lose the lordosis or the curve in the lower back, more pressure is applied to the front of the spine, the disc, causing a compressive irritation. So one of the key components, no matter which patient it is that we're trying to rehab, if their pain is aggravated by flexion, we always include extension training to give them the strength to counteract the tendency to flex forward with their sports, with their workouts, with their daily activities. Now, a lot has been talked about the posterior chain, doing exercises for the glutes and the hams, lower back endurance training. We know that extension exercise is very important for disc problems, especially endurance extension exercise, but a lot of people don't train the actual increased lordosis or anterior pelvic tilting motion that's essential to a lot of those lower back cases. The lower erector spinae muscles, the multifidus muscles, assists in lifting the sacrum, the base of your spine, upwards, increasing the arch in the back and helping you to hold that curve that resists flexion. One such exercise we're going to talk about today is anterior pelvic tilting against the weight attached to a dip belt. So once you understand what your RPI neutral spine is, because remember, you want to make sure this exercise, like any good rehabilitative exercise that we teach here at painfreeandfit.com, is tailored to your body. Anterior pelvic tilting may not be your thing. You don't want this. Again, if anterior pelvic tilting is your thing, if it's protective and it resists flexion, you want to include with it other RPI neutral spine parameters or considerations that are unique for you. My particular spine, I want to make sure I'm not hip hiking on the left hip. So as I do this exercise, I'm going to be keeping my knees bent and holding my left hip slightly down. I'm going to be lifting my left rib cage up because my tendency is to hip hike and laterally flex to the left when I'm under load, when I'm under stress. I've identified this, and you will identify this through an analysis, an in-depth analysis of your body mechanics, your posture, your movement tendencies, your stability issues, your muscle imbalances. For instance, my L5 multifidus has a tendency to weaken and be inhibited. So when I do this or any exercise for my lower back, I'm going to make sure I'm focusing on creating a contraction of that left L5 multifidus. Some of you may need to disengage your right internal oblique muscle because it overcompensates and contracts when you draw in your lower abdomen and contract your transverse abdominis. So whatever it is, whether it's an overactive lat muscle, an underactive stability muscle, a posture movement tendency to go to one side or to rotate your hips to one side, I'll also be including a slight rotation of my hips to the left because I suffer from a left external hip rotation. We all have something. So just don't do this exercise generically. Make sure you're doing it right. That includes all your corrections for your unique situation. Otherwise, if you're just doing it generically and tilting your pelvis up, you'll probably be strengthening dysfunction of these weak and overactive muscles and create more of an imbalance, which actually leads to more stress and usually more pain with disc problems. So here we go. I've attached a dip belt around my hips. Remember, I'm not having that up high. This is not a low back stability setup where I have the belt up high in my lordosis of my lower back or in the curve of my back. I want to make sure that dip belt is positioned low so it's hanging on the side of my hip bones, my iliac crests. Once I have that set, I'm going to take a weight. Now, when you're beginning with this exercise, you want to make sure you're using a lighter weight, maybe a 5 or 10 pound weight, and this is only after remember this exercise, only after you've already increased some endurance strength in your extensors. Exercises like bird dogs and full spine extensions and hip extensions and walking exercise to increase hip extension, glute bridges, squats, single leg deadlifts without weight, just with body weight. You want a good base of maybe 6 to 12 months of extension training before you start using this exercise. Otherwise, you're not going to know how to stabilize yourself. You're not going to have a base of extension strength to add this type of exercise. So we're going to take 45 pounds attached to a chain. I like plates. You could use dumbbells as well. Dumbbells have a little bit of a tendency to wobble more, a little bit more instability. So that's great if you're down the line and you want to challenge yourself against that instability to hold your unique RPI, neutral spine. But from the beginning, you want something stable like a plate that lays flat against your body. It's a little easier to control. So we're going to attach that to my dip belt. And as I do so, I'm going to attach it in the front just because it's a lot easier to make that setup. I'm going to use a bench for a little support, and then I'm going to spin the belt around so that the center of pull is centered with my body. You want to make sure that that band or that chain is directly in the center. You don't want to work it off to one side unless your unique RPI or neutral spine setup needs you to work asymmetrically for one side. I can use that in a different type of exercise. I'm going to engage my core. I'm going to set my RPI neutral spine. Again, for me, that's left multifidus when I pull in my transverse abdominis. Left hip down, left rib up for me. Whatever it is for you, you have to engage it. You're going to slowly release that weight and let it hang. And you're going to notice that is going to want to pull my pelvis backwards. It's going to want to flatten my lower back. The weight is pulling back. The dip belt is pulling my pelvis this way. So here comes the exercise. As again, my unique RPI, neutral spine, and core muscles are already engaged, so that doesn't yank me too much into flexion, aggravating my discs. And from here, I'm simply going to anterior pelvic tilt. I'm going to raise my tailbone up, increase the arch of my back, hold that for a second or two, and slowly let it down. I'm working in a pain-free range. If I anterior pelvic tilt or arch my back too much, past my neutral spine, again, you need to know what that is through an analysis. I could be damaging soft tissues in my back. I could be damaging facet joints, disc fibers, posterior ligaments. As I go into posterior pelvic tilt, let my body flatten. Again, I don't want to go too far because that's compressing the disc. So I always work within a range that's pain-free, and I've determined that to be comfortable through my earlier exercises and rehab experience. So that's the exercise. I can hold it for isometric times of up to 1 minute to 3, or I can do it for repetitions, holding it for 2 to 3 to 5 seconds a repetition. And if you notice, the movement is not a lot, but it's enough to engage those extensors. And if you put your fingers back there, if you palpate your multifidus muscles off those knobs in the center of your spine, you'll notice they're engaging. And for me, again, I'm focusing on keeping, you notice my knees are slightly bent, my left hip down, my left rib up, and my brain is focused on that left multifidus contracting because that's the one that has a tendency towards inhibition. So I want to really strengthen and rehab that one to support my neutral spine. So when I get back into sports, activities, when I do things, I'm not going to have as much tendency to flex forward because I'm going to have the strength and the coordination to engage my extensors, hold my spine in neutral position, and eliminate soft tissue stress. If you like this video on multifidus and extensor training for disc problems using a dip belt, feel free to subscribe to our channel. We've got a lot of great videos out there. Questions or comments, write in. As always, I'll do my best to answer them. If you're looking for a great program to figure out how to analyze your mechanics, your posture, your movement tendencies, how to start increasing a neutral spine position in your body and engaging the right muscles, and then take that and step by step go through the various stages of advancement in your conditioning to make your back strong and fit again to prevent injury, check out our fast track program for degenerative disc disease. It's great not only for degenerative discs, but herniated, bulging discs, available at painfreeandfit.com. I hope this video on anterior pelvic tilting for chronic disc problems helps you with your lower back issues.